Hello, I'm Dr. Brian McDonough with the new normal for Monday, June 22nd, 2020. And I have a very important message for young people, and by that I mean people under 35. The sense through the media and everyone else has been that if you're young, you're going to get through this and you're going to do well. Let me rephrase this. If you're young, you are less likely to die than an older person. You are less likely to be hospitalized and die than a person with pre-existing medical conditions. But you're not going to get off easy. There will be damage to your body. Remember, this virus aggressively attacks the endothelial lining of blood vessels, whether you're young or old. It blows up the lining of blood vessels. What that does is it causes inflammation. And we're finding that in young people, it is doing early damage to the lungs. Damage that I don't know if we can equate it to years of smoking cigarettes or exposure to radon or whatever you want to say, but it's doing damage to the lungs that could reveal itself as bigger problems in 15, 20, 25 years. Now that may not mean much to you when you're 26, 30 years old, but it will mean a lot when you're older. So the fact that some people are taking a laissez-faire attitude that, well, I don't need to wear a mask, I'm young, I'm going to go to the beach. Yes, you run the risk of hurting people who are older. You run the risk of hurting people who are at risk. But you also run the risk of hurting yourself. And you need to understand that, because if you're not going to be safe for older people, for people who might be ill and have greater realistic threats of succumbing to coronavirus, you yourself will have problems down the road. And I think that's what we're not getting across as a message to people. The bottom line here, I'm going to say it over and over again, as we open up the country, if we are not tracing and tracking through testing and doing it everywhere around the country, and if we're not essentially universally wearing masks, and if we're not practicing social distancing, we're going to be in big trouble. We're going to find that what we see in the next months will be far worse than what we've seen in the past months. But we have an opportunity if we jump on this now, and we have to be aggressive about it. So again, anyone who's watching this, wear masks, social distance, wash your hands, clean surfaces. It's the same message I want to give you over and over again. Again, I don't care what the politicians are saying. I don't care what the networks are saying. These are the facts. Read the literature, read the evidence. That's what I'm doing. I've been doing it since the beginning. And it's really not taking a Rhodes Scholar mind to figure this out. It's just looking at it analytically, scientifically, and following the path of this virus. If you do it, we got a shot. And if we do it aggressively as a country, we have a better shot. If not, we're going to be one of these countries falling behind and having more problems. And we're going to have problems for a while, not just a few months. This is going to be a wave that's going to go through our country for an extended period of time if we don't get a handle on it.